Anca, hi, and thank you so much for joining me on Faces of Digital Health to talk about something that's very close to you, was close to me when I was a teenager, and that's gaming. We're going to put it in a specific context, that's the use of gaming and VR platforms for health education. So I, given that I don't play games at the moment, I'm really curious, what's your story? Do you still play games? Why do you still play games? How did you get into this field?
That's an interesting question. I am a gamer myself. Like about half of the human population is considered a gamer. And just as a disclaimer, a gamer is not someone who spends days and nights in front of a computer playing games. If you play Candy Crush or Angry Bird or any of those games, you're still considered a gamer. So I'm part of that half of the population that plays games. And I remember when I was a kid, I would love to play myself, but I also love to watch others playing, which is also a way that people consume games. If you look at streaming numbers, for instance, you see that a lot of people don't play themselves, but they watch other people play. And my earliest memories are of me watching my uncle and my dad play games and thinking that maybe one day I'll be able to do so as well. So I started with, I was always a PlayStation kind of gamer, always played on this, still play to these days, a good RPG game, those fantastical universes. I think it's a way to disconnect. It's a way to tell stories. It's a way to push messages across when they're well done. And it's just a way to evade your everyday life and go into some magical universe and think about something else and have fun for a moment. So yes, I'm still a gamer to these days. I love those games. And quite recently, when we saw that those platforms, the gaming platforms, the Fortnites and Minecrafts of this world were opening up to creators, we thought that was interesting because when you open up to creators, anyone can use those platforms to push a message across.
Mm-hmm. So, given that you are in these spaces, what are your observations over time, especially with this creator approach that you mentioned is now changing?
Well, what's really interesting is that when you look at a game such as Fortnite, I don't know the exact number, but a very large portion of the audience plays the creator games and not the main game. So just to give a bit of context for people who are not familiar with a game like Fortnite, Fortnite was created in 2017 and it was initially what we call a battle royale, meaning that the scope of the game was that you were dropped onto an island. You and 100 other people, and the idea was to be the only one left. So you had to basically kill everyone else and be the one standing. And that was the core game. And when they opened up to other creators, everyone came into the platform and created their own game, which was similar to Battle Royale, but you had things that were completely different. And today, I think most of the traffic on Fortnite goes to those creator islands instead of the main game. And that's a major shift because that means that as long as you stay within the codes of the universe, of the Fortnite brand, you can create any type of content you want, any type of adventure and experience you want. So that has created a huge creator economy. And now you have people in their rooms creating maps, but those people have actually turned into studios that are generating millions of revenue by creating this type of games for brands and for companies.
Mm-hmm. I'm gonna ask you a very stupid question now, because as I said, I'm not a gamer. So how does one even start? Like, say I want to explore Fortnite because I want to create something that's health related. Where would one begin?
So that's a good question. So Fortnite is available on a bunch of different platforms. You can go on Fortnite through your computer. And when you arrive, you would have something that's similar to, let's say, sort of a Netflix platform where you have at the top the main game. And then just as you have different movies on Netflix, you would have different games on the Epic Games Store on Fortnite. So you would just click on the one that you want to play, and then you enter the game like you would enter any type of other game. That's from a user perspective if you want to play. If you want to create, you have something that's called Fortnite Creative, which is sort of the back office, the studio, if you will, of Fortnite. And there you have a platform that allows you to build the game yourself or a studio that you're working with. And basically, building a game is, first of all, creating the storyline. So this just requires your creativity and imagination. Something called the lore, which is basically the story that you're going to tell. And then once you have the story, the characters, the messages, you can start developing. It's basically developing a game. So you have to create the art, you have to create the characters, you have to create the look of the space that you're creating, and then all the game mechanics. Who talks to who, how do you advance in the game, and all that technical aspect. And then once it's ready, you just put it out on the sort of the store, if you will.
And it's available to everyone who's using the platform. Have you ever tried to create a game?
We are in the process of doing that. We have 3 different projects at the moment. The one that's most advanced is one around immunity. We've all been through COVID. We know how difficult it is to sometimes explain how our immunity works, how to protect our immunity, how to protect from viruses and bacteria out there. So the first project that we had, which started a year ago, was how do you create a map, so a game in Fortnite, to explain to young adults how your immunity works and how to protect it. So that's the first thing that we did. We have created all the concept of the game. We have sort of a draft of the look and feel of the game. And now we're looking for partners to actually develop and deploy the game. We've done a similar approach with diabetes as well, because there's a lot of stigma around diabetes, especially when kids have type 1 diabetes. Sometimes they're mocked at school because why do you have type 1 diabetes? Are you like lazy? Are you eating badly? And type 1 diabetes has nothing to do with how you eat or if you exercise. So there's a lot of stigma around young kids. So we're also want to fight this inside a game. And what's interesting in the game is that the character that you embody can be anyone. It can be a kid with type 1 diabetes. So you can put yourself in the shoes of that kid and go through the game as if you had diabetes yourself and see what that looks like. So it's very powerful in terms of learning mechanics because you really can create an environment like that.
In 2022, you wrote a collaborative article on 5 ways pharma can benefit from the metaverse. You often have talks about the use of VR and gaming for healthcare purposes. Gaming as such is not a new concept, even in healthcare approaches. But still, can you give us a few examples of successful either games, campaigns, or other projects that have been launched in healthcare?
Yeah, absolutely. So I think when you talk about gaming, there are 3 different ways you can approach it in healthcare. First of all, you have everything that has to do with digital therapeutics, which is using game for therapeutic purposes. And a lot of, some of the digital therapeutics out there use gaming and gamification as a way to engage the audience and make sure that people use the tools. We had an interview last year with a company called Tilac, which is a French company that does testing for the eyes. And they use gamification to make sure that people are engaged and use the app and do the test every day or at the pace that they're required to. So when you use gamification in digital therapeutics, that's a very specific way of using gamification. It's a therapeutic sort of way to use gamification. But then you also have the more communications way of using gamification. And here you have either companies that create their own games, and we've seen that for years and years and years, especially for if you want to teach something to a kid about asthma, for instance, you would have these platforms where you have games and quizzes and enigmas that you have to go through to answer questions about your asthma and learn about your asthma. And then what we're seeing now is quite new because platforms have opened up to creators quite recently. And this is something that's emerging, is using those social gaming platforms where you don't create a therapeutic game, you don't create your own game, but you use a platform that already has an audience to create a game. And that's completely different because you're approaching it, it's as if you're creating a partnership with an Instagram account. You are targeting already an existing audience and all the ecosystem around that audience, which you don't if you create your standalone game outside of any platform. So it's really an evolution from creating a game out there to maybe doing it for therapeutic perspectives to now creating a whole community and ecosystem around your game to target an audience.
I've got a bunch of questions. So I want to talk about the impact on younger generations with games like this. But
Yeah.
before that, given that you are working in the digital health space, you're based in France, so you have a good overview of what's going on. France has started with the reimbursement of digital therapeutics last year. But personally, I don't see a big boom or a big uptake of these solutions. So I'm wondering what you are observing. Are games and gaming approaches taken seriously by insurance companies, by the reimbursement? So what are you observing? And you can limit yourself to the French market that's most close to you.
Sure. So it's something really interesting that someone told me once, someone building a digital therapeutic. They told me that gamification is not part of the therapy. And I thought that was interesting because I always thought that the gamification aspect could be part of the therapy because that's what drives engagement. And they told me no. If you want to drive engagement, you use gamification, but this is not something that we evaluate when we look at the digital therapeutic to evaluate the outcomes. The outcomes are evaluated based on what the solution does outside of gamification. So gamification is really just a way for the company to ensure that people are engaged, that use the solution frequently and so on, but it's not part of the therapy per se. So everything else is what is being looked at and evaluated when these devices are looking to be reimbursed. Now, the reimbursement market in France is quite complex. I'm not really a specialist of this, but I do see from the outside that it's slow. I do see a lot of people coming forward saying that they have tried and failed and they're going to retry. So I don't know the specifics of what's going on at the moment, but I do see that it seems to be quite of a bit of a struggle. First of all, from the regulatory pathway, although we have Pécan and all these things that make it faster, but also from an adoption standpoint of both the users and the healthcare professional, and then also from a data generating perspective, where the data that are generated by these solutions to justify their reimbursement are not always and are most of the time not aligned with the regulatory demands to be reimbursed.
Yeah. That's kind of the observation that we have when DIGAs were introduced in Germany, and when after a year it was re-evaluated how much the DIGAs should be paid for. The prices were basically slashed in half, and I know that France, when they designed the system, they already in advance said how much you can expect to be reimbursed, which I guess is not very sustainable for many companies. Which I guess brings us to the next meaningful questions, which is gaming is interesting, it's very engaging, which can drive adherence to therapies. I just, like when you were talking, I just remembered on the company called Perifit that designed a medical device to help with pelvic floor strengthening. And basically you have to work on your pelvic floor muscles, but the way that you do that is with also a help of game that kind of makes it much easier for you to do the exercises for 10 minutes than if you just were trying to mentally think of the muscles that you need to engage. So where do you see the price and cost side of creating games for engagement and better health outcomes?
You mean in terms of the sort of negative aspects of gaming?
Yeah, so basically, games are great because they engage people. So why are they not developed more? Is it too expensive to develop games to engage people? So
Sure.
is the aspect um, still not is the perception still not positive enough so that companies would think, yeah, we definitely need to do a game to just engage our people.
Yeah, I think there are so many different aspects to this question. First of all, I think that we have companies in healthcare have created games for a very long time, whether it is board games or online games or things like that. The struggle that they have is when you put these games out there, how do you build an audience? And this is something that everyone is struggling with, is not enough to put content out there. You have to reach the audience. And this seems very easy said like this, but a lot of people, when they create this type of campaigns, they put out a game and they don't have any type of strategy or any type of budget to actually build an audience around that game. So they just put the game out there and they're like, maybe physicians are going to recommend my game, and then people will just have to follow a link, arrive on the game, and play. That's the approach that we've had for years. It's not one that works very well. It can work in very specific context, but it's not one that can be spread out globally. The promise with social gaming platforms is that you are going to create your game in an environment that already has audience. And that is important because you have an opportunity there, but you need to know how to use that opportunity. Because you can create a game, for instance, in Minecraft or Roblox, but if you just create the game and put it on the store, then no one's gonna look at it. It's like creating an app, putting it on the App Store. That doesn't mean that people are going to download it. So you have to create your media and promotion campaign and strategy. And the advantage is that you have a whole community around these social gaming platforms. You have influencers and streamers and YouTubers and whatnot that are around these gaming platforms that you can work with to create these experiences. That being said, there is around a lot of stigma around gaming. I was in a working group recently and we were talking about how do you engage patients in the development of artificial intelligence solutions. And I told them, well, I think you should approach this a bit like gaming. Gaming studios have what they call beta testers. And those testers are people that are going to work with the studio throughout the development of the game to test, give feedback, being involved, and ultimately, if it's a good game, be ambassadors of the game. So why not have a similar approach in healthcare where you involve patients all the way in developing a project, they become ambassadors. And the response was, sure, that's a great idea, but let's not use the gaming industry because we want this to be a serious report. So there's still a lot of stigma where if you do gaming and games, you're considered not serious.
Yeah.
But we have obviously proof that gamification is a way to engage, and it's a very effective way to engage. If you look at conferences, anytime there's a quiz, a game, a raise your hand, people are engaged. So we're not lacking proof that it's engaging, but I think we still have a perception that gamers are teenagers in their room, where it's not the case. So we still have to work around that.
Yeah, yeah, yeah. It's a great point, especially when we, in terms of mental health and well-being, we talk at the moment a lot about the negative impact of social media, screen time. If you're a parent and if you're conscious about these warnings from specialists, you definitely don't want your kid to be behind the screen, or at least limit the time behind the screen very carefully. But that also brings me to younger generations. There's always a generation gap between generations in terms of how you communicate, how do you understand each other, and especially with Generation Alpha, you can find tons of memes or videos online about how different their language is. And it's not just that, words would slightly be changed. They actually use words that have a certain meaning and it means something completely different from them. So for us, it can be completely incomprehensible listening to these younger generations. So what I'm wondering is, what do you know about younger generations and how to engage with them? And what's the role of gaming in this equation?
So you are completely right that it's a generation that has its own codes. Maybe every generation has its own codes, its own way of expressing itself. I was actually listening to a psychologist once that was saying that each generation has a new way of talking and using words just to make sure that the generation before them doesn't really get them. So it's sort of a strategy to differentiate yourself from your parents and grandparents and so on. So yes, that does exist. I think what's interesting for us is that when we're trying to target these audiences, we're not looking at targeting them directly. We're looking at how do we target them through the people that speak their language. So through the influencers that they follow, through the streamers that they follow, through the YouTubers that they watch. And so this allows us to have sort of an intermediary between what we want to push as healthcare messages and the way that we have to tell these healthcare messages so that it reaches the right audience. Mm-hmm. What's also interesting is that we do not work with social media channels and creating short format videos and things like that. When we build the campaigns, so in the company, what we do is that we create communities at Magic Studio. We create communities for healthcare companies. So patient communities, healthcare provider communities, tech communities, and so on. So what we're looking to do is use channels that can allow us to push messages in a very effective and engaging way. So we would look at things like podcasts, for instance, because people are going to listen for like an hour maybe to a discussion and they will learn things. Social gaming, because people spend an average of 15 minutes on games, whereas they spend like 20 or something seconds on TikTok. So we are looking at these channels that can drive and create engagement. And once we've targeted the channel and the game and the messages that we want to push, then we're going to work with the creators that can transform these messages and that game into something that's understandable for a younger audience, that's understandable for their audiences. So it's really not us us directly working with the kids or young adults. It's working with those that they follow and that they admire and they engage with.
Mm-hmm. Yeah, I was doing some research around just how the younger generations think, like who do they engage with, and I guess what was insightful was knowing that they really react more to less polished content that seems more natural than, for example, high production advertisements, and the kind of the final message was that we should think about under 20s less as the target audience, but more as creative collaborators. So my question here is, if anyone listening right now is coming from a health tech company or a pharma company, what would be your advice in terms of the things that they should think about? And maybe the key misconceptions that you often observe?
Well, I think they should really look at social gaming platforms like a new tool in their marketing strategies and communication strategies. Just as they have press and social media and printed things and so on, social gaming has to become one of those channels. Once you identify that social gaming is one of your channels, then you have to look at which one of them are you going to go for. And that really depends on your demographic. If you're targeting people that are a bit older, maybe 20 plus, you will go for a platform like Fortnite. If you're targeting people that are a bit younger, like 13, something like that, maybe you will go for something like Roblox. And depending on the target that you have, it can even be 30 plus, you will use the appropriate social gaming platform. And once you set okay, so this is my strategy, this is the platform that I'm using. You really have to work with the ecosystem of that platform. People who are going to help you translate the messages that you have in healthcare into something that can be played on one of those platforms. This is part of what we do. And then we work with what they call mappers, which are creators inside that universe that will actually develop the game itself. And then once you have the game, then you have to create the media campaign, which is who am I targeting, who are the influencers in this space, who are the streamers in this space, and how am I going to get the message across and make sure that the game that I created is going to reach the right audience. So basically, that's how you would go about if you want to create something.
Well, Anca, thank you so much for sharing all the insights. Is there anything else that you would like to share in terms of what surprised you most in the last few years, where when you've been involved in the space and have been working on projects that use these techniques to engage people for healthcare purposes?
It's always very impressive to see how gamification is creating so much engagement, but it's how also very underused it is in healthcare because companies sometimes have the impression that, we're serious people. We're not going to go into this space. And this is something that we're fighting. And this is something that we want to make very clear is that if today we don't have a world premiere yet of a game in Fortnite or Roblox dedicated to healthcare, it's not because we're not trying. It's because ultimately the companies need to take a risk. They need to be the first, which is not something that we really like in healthcare. We like when other people do it and then we look and then maybe we'll do it ourselves. But we also have to change the mindset around gaming. The number one question I get when I talk about gaming platforms is, but we don't want our kids to spend more screen time in, and we don't want them to play games longer. And that's fair. That's a good remark. But it's like if you're doing a social media campaign, you're not going to stop because you don't want your kids to be on your phone. You're going to approach this differently. You're going to be like, this is who I'm targeting. This is where my audience is. So I am going to go there. And if they spend time on a game or on social media, they might as well spend time on some educative content, something that's going to be informative and something that's going to help them. So I think we need to change the mindset and approach gaming platforms as an opportunity to get messages across rather than, something far away from us where just kids and teenagers spend their time and we're not really involved with. So there's a mindset to be changed. And I think that once people see the opportunity, it's really hard to say, there's a huge audience, I'm not going to go target it because
Yeah.
it's a massive opportunity.
Absolutely, absolutely. It just makes me wonder to which extent, companies or organizations are willing to put in the effort and also, I guess, funding to do this. I remember when I was still working as a medical journalist and I would go to congresses, um, in the exhibition space, VR would always be with pharma companies so they
Yeah.
could demonstrate how specific therapy works, which was great. But at the same time, it kind of felt as if, of course, pharma is doing this because they've got too much money. And of course, nobody else is doing that. So I don't know how much that is also a factor that kind of impacts who uses it and who doesn't.
I'll be honest, it does. The people that we work with are 90% pharma companies, just because that's the way that we've structured our business approach. But yes, they are the easiest to approach with this kind of innovative stuff because, when you have a constrained budget, you're not going to go for the innovative thing that very few people have tested. You're going to go for something that's, tested and approved and safe because you have a limited budget and you have to invest it in things that are going to return. So if you want to do something that's never been done before, you need to take the risk. To be honest, it's not that big of a risk because we know that it works very well in a bunch of different industries, and they have very good data and performances in things like retail and automobile and all these industries where they have tested games. So it's a limited risk, but it's still a risk. It's still something that's very different from what we do in healthcare. So yeah, I think the sort of normal strategy would be to go for the people who are willing to take the risk and have the budgets to do so. So obviously the pharma is the sort of first early adopter, but then I think that the cost of creating a map and a game in these platforms is going to decrease substantially. You have creators out there that are just, sometimes kids that create their own maps, and that you can collaborate with these people and create things that are very interesting but not very expensive. So I think it will, as it develops, it would allow for a lot of different people to create a lot of different types of games, very complex and expensive ones, very simple ones and not expensive. So we'll see a lot of different ways of approaching it as the market grows.
Absolutely. And luckily, we've got startups and VCs that are also willing to take the risk and try
Yes,
new things.
absolutely.
Anca, thank you so much for sharing all the insights, and do keep me updated on the games that you're going to be creating.
You'll be the first one to know.